My name is Dr. Premal Patel. I'm a men's health specialist and co-founder of Men's Health Clinic Manitoba. Let's discuss varicoceles and male infertility. So infertility can affect 1 to 6 couples, and a male factor can be as high as 50% of that. One of the most common causes for male factor infertility could be varicoceles. So what are varicoceles? Varicoceles are dilated veins in the spermatic cord. So where the testicle lies down in the scrotum, you have these veins that are dilated, and what they do, they expose the testicle to heat and other potentially toxins that can impact the sperm motility, the concentration, and the overall shape and function of the sperm. So these varicoceles can actually lead to a lot of issues with fertility. Now, it all sounds great. Struggling with fertility, I've been told I have a varicocele. Why don't we fix this and maybe I can start having a family? The problem when it comes to varicoceles is that they're very common actually. So quite a few men have varicoceles and not all of them have issues with fertility. So it's really important to put all those factors together. So when I see somebody struggling with fertility, I really want to go down to their medical history, their past medical history, their surgical history, their partner history. I want to get a sense, are there any potentially other factors that could be in play that's causing issues with fertility that may not be associated with a man, potentially with a female, or could be a both factor. So how does that work? So the first thing we're going to do is we're going to do a thorough history and physical examination. So we're going to get a sense of the patient's past medical history, surgeries, going to evaluate them on a physical examination standpoint. Going to look for secondary sexual characteristics to see if there's any potentially low testosterone issues. We're going to look at their external genitalia, take a look at the penis, make sure there's no issues with the tip of the penis where semen is coming out. Take a look at the testicles, make sure there's no lumps and bumps, make sure the vas, which is delivering the sperm into the ejaculate, is present, making sure there's no other abnormalities. After that, we're going to get 2 semen analysis studies. So these sperm tests are typically collected after abstaining for intercourse for at least 24 to 48 hours. You bring the specimen to a lab and they'll do a thorough analysis of it. We're also going to get some hormonal evaluations, and this will include your testosterone, your LH and FSH. These are all important for sperm production as well as testosterone production. Now, on that examination, when I see the patient in the clinic, I may diagnose them with the varicocele, and it's more commonly to be associated on the left side versus the right side. And that really depends on the anatomy and how the veins drain, because it differs on both sides of the testicles. When it comes to varicoceles, if someone has a low sperm count and they have a varicocele, then I may consider a varicocelectomy. So what is a varicocelectomy? So a varicocelectomy is essentially getting rid of those veins or tying them off, or essentially blocking the flow of blood through them so that you're improving the normal circulation. Essentially, a varicocele is a dilated vein. So those veins are just not functioning properly. And by getting rid of those, we're allowing the normal veins and the normal blood flow to happen naturally. The testicles are essentially outside the body because they want to be in a cooler environment, right? So if you're exposing, or if they're being exposed to excess heat, and I don't mean 1 hour of being in a hot tub, I'm talking about 24 hours of a varicocele impacting the testicle, you may notice that testicle may be smaller and you may notice fertility issues. So in terms of how do we treat varicoceles? Well, there's a couple different options. So number one, we may do what's called a microsurgical varicocelectomy. This is a procedure that I commonly perform, where I make a small cut in the inguinal region and I'll identify the spermatic cord. So patients often think, okay, well, the varicoceles are down. How come you're cutting me up higher? Well, it's because the spermatic cord actually runs up. You want to make that incision at the point where we can access those veins, and then under an operating microscope, we tie off those dilated veins, and then using a Doppler, a little ultrasound probe, we can actually identify the artery to prevent any unnecessary complications. When it comes to the procedure, it typically takes 1.5 hours to 2 hours, depending if we're doing one side or both. It's a day procedure, so you'll go home the same day, and after the procedure, you want to refrain from heavy lifting for about 1 or 2 weeks. When it comes to noticeable changes, it may take about 2 to 3 months. So we do get a sperm test after about 2 to 3 months, and then we'll do it after 3 months after that. Now, what are the chances that a varicocele actually helps? That's always the difficult part about this, is because it's not that all men will have issues with fertility. So a varicocelectomy, or getting rid of those varicoceles, may only improve in about 50 to 70% of cases. Now, what are potentially other options to treat varicoceles? That may include something called embolization, and this is often done by a doctor that's an interventional radiologist. Well, they'll go through a vein and they'll have a metal coil to essentially block those varicoceles and improve the circulation. It's less invasive than the surgical options, but the recurrence rate, so the chance of it coming back, it's higher with that than surgery. So when I see patients and I evaluate them, get all the history, the physical examination, the blood test, the sperm test, really get a sense of what's going on, then I may offer them a varicocelectomy to try to improve their chances to naturally conceive. Now, when it comes to varicocelectomy, apart from just the sperm counts improving, you may actually notice that the quality of the sperm improves. So there are situations where a couple may tell me, well, we haven't been able to conceive. I have a large varicocele, but I may just move on to IVF. Well, there are studies that have shown that improving the quality of the sperm by a varicocelectomy may improve your chances of IVF, right? Or even intrauterine insemination. So there are benefits to a varicocelectomy. Ultimately, it's really important to see your doctor if you've been trying to conceive with your partner for at least 6 to 12 months and having no success, and getting those testing evaluated and getting referred to a specialist in fertility, because there are fortunately good options available to you, and it's important to find out what those are. So to learn more, visit mhclinic.ca or book your appointment now.